Hi. I can't see who it is yet. I'll give you a shout out here in a second. I can see. The screen is way too little. Let's see. I hope everybody had a good Wednesday. Come on. Thank you. And I'm having coffee. Thank you to Oxford for their amazing swag. Yes, I still use the swag that I got from conference. I still use my HEMA bag that I got from Baltimore a couple of years ago. I like that one better than the one from last year's conference at so in Salt Lake. They gave us a backpack, which it's a nice backpack, but I can't use it like for every day, you know. So that's why I like the Ahima bag. It has like Ahima. It has the logo on it, and it's gray, and it fits everything perfectly. So I'm like, I'm still using it. All right, hey Jamie, thank you for all the blue hearts. I love seeing the blue hearts. Hi Crystal. Hi Michelle. Hi Liz. Yes, I'm glad you're here too. Um, Hi April. Hi Alexandria and Alexandra. Hello. And Letty, I'm doing great. Thank you so much. I'm having my coffee out of my Oxford mug that I'm still using from a conference that I got in Salt Lake. So, anyway, I came on live tonight because I don't have a show, but I am going to film a show for tomorrow night. So, y'all will get it. I don't know if I'll be in the chat or not, but I will go ahead and leave it as a premiere so that way you guys can chat because I know y'all like that. And I think for some reason when I have it as a like a I schedule it, right? If I schedule a show and I don't put it as a premiere and y'all can't chat, for some reason a lot of people, I don't know if it doesn't alert, so I'm just saying. But it'll be on. Like I said, I don't know if I'll be on or not, but it'll be on for you guys so that way you guys can watch. Tonight is just whatever you guys want to talk about. But I do want to kind of talk about the credentials because okay, so let me go ahead and just get into it. So let me go ahead and say, if you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Thank you guys for joining me on this live. If you have any questions, I am here with y'all for the next hour. But if you have any questions, please don't make them really basic. Like, how do I get started? Because I'm going to stare at you. Uh, because I have so many videos. I have 1,400 videos. And if you want to like get an idea and you don't want to go through all the videos, you can actually Google. You can Google me. Medical Coding with Blue. Resume tips, medical coding with Blue. Study tips, medical coding with Blue. Medical terminology, medical coding with Blue. Independent study. All of these videos will come up. So I try to be really specific on the titles of the shows. Sometimes I go off on a little tangent, but rest assured, most of the episode is going to be about that subject anyway. Okay, so. Alrighty. Yes, thank you so much, Alexandra. I swear, it's so light, I can't even see. It starts with an S. Hello. All right, so let's talk about the credentials. So a lot of times when people are new to medical coding and to trying to get into the field and they get their first credential, let's just say, for example, they get their CPC. And then they think that they need to get more credentials because I got a message from a lady today and she's like, Blue, I can't afford any more credentials or I can't afford any more school or any more programs because she's on a firm like that payment program and she was thinking about getting billing and then people were telling her to get billing and then I'm telling her because the video she watched was about the CPB that you don't have to get it And then now she's confused. And then maybe she should get into auditing, which I know she's referring to the CPMA because she's saying that she doesn't have any more money to pay for courses. Okay, first of all, if you are in your first 2 years of medical coding, if you haven't gotten a job yet, if you're just out of school, getting an additional credential will not get you hired faster. It's ridiculous to see people with a string of credentials still being a CPCA, And the thing about it is, I am not against additional education. Y'all know me, okay? If you've been with my channel for more than 5 minutes, y'all know that I am not against additional education. What I am against is trying to dress up your name without having the experience. You shouldn't get additional credentials unless you have experience to back it up. That is the only reason that you should ever get additional credentials, okay? And as far as the CPB, I have said to people who are billers, they don't want to be coders, they just want to do billing. Yeah, that would be great for you because you should get some kind of formal education or some kind of training. So CPB is good. And then if you're going to be a biller and you're going to compete for contracts, it's nice. If you have a credential on your name, it's not necessary, but it is nice. So then, yes, that would be okay. But for my CPCAs and my CPCs, you guys are already tested on reimbursement on your CPC. Now, are you tested on all of these things about billing? Absolutely not. But then think about the CPB. Is it testing on every single thing and every single payer? No. It's giving you the basics and the fundamentals. And like I said, there's nothing wrong with going through the course. I just disagree that people should be pressured to getting a bunch of credentials. You shouldn't. You shouldn't. And people who sell and push these credentials on brand new people and they know they don't know about the industry, that's just ridiculous. You know, now if you don't know, if people are listening to you, like say for instance, you're a recruiter, I've heard of people doing this too. To my veterans, this one fella said that he was getting training through this veterans program. And the recruiter of the school was telling him, hey man, you need to get this credential, which is a CPC. You need to get this credential and you need to get the CCSP. I'm like, they're the same freaking thing. Like they have different formatting, but the fundamentals of these exams are the same. They're both covering outpatient coding. Why would you have this person to get both credentials that are saying the same thing? And so he happened to come on here. He's like, yeah, I'm going to get the CPC. And then after that, I'm going to get the CCSP. I was like, why would you do that? You pick one or the other, you know? And he's like, well, my recruiter said that I should do it. Is your recruiter certified? No. So why are you doing it? You know, like I said, I want y'all to save money. Okay. A lot of y'all are so concerned about, oh, I want to make high dollars. And then when it's not this high, ridiculous salary that the schools are pushing, then y'all are disillusioned and disappointed. And then coming on here talking about, oh, well, why can I get paid more at Panda, working for Panda Express than I do as a medical coder? First of all, that's not true. That's not true. I mean, yeah, Panda, they pay pretty good, but if you're at a place and they're paying you less than you would if you're working at Panda, that's not the place you need to work, right? You have a choice on where you want to work. And keep in mind that when you're brand new and you're starting in the industry, they're taking a chance on you as well. You have no experience, ma'am or sir. You have no experience. So why are you going to say, I want this really high salary, but I'm putting no effort in? Well, Blue, I passed the certification. You passed a multiple choice certification. Keep that in mind. You passed a multiple choice certification. Nothing wrong with passing a multiple choice certification exam. Certainly not. However, if you don't have experience, what you step into and somebody taking the chance on you to sit with you and work with you and get you trained up, that's where you're going to start. Now, when I started, to me, it was a good salary. I was grateful because, again, when you give off grateful energy, you're going to get so much more back. And of course, you need it to be genuine. But where I started off was a really good rate. And I was like, okay, this is cool. And it was at a temp agency. I got my first job through a temp agency. Okay, I always encourage you guys to go to the temp agency and make sure that you are registered with them. And then I get this pushback. Blue, I need benefits. I need this. I need that. I need full time. I need part time. Okay, no. You want to get in somewhere. You want to get an assignment. You're out there looking for a job right now, and it may take a couple of months. It may take 3 months. It may take 6 months to find a job. But if you're registered with a temp agency, temporary agencies for medical professionals is what you put into Google. You put that into Google, you register yourself with them, and then let's just say somebody at this place is going to go on maternity leave. Hey, y'all have any certified medical coders over there? We need help for 3 months. You know what? Let me get back to you. You know what? There was that person who came in talking about that they were a medical coder. Let's look for their resume. Oh, here it is. Oh, okay. You know what? Let's give them a call. Do you think you might be interested in a 3-month position? Somebody's out on maternity leave and they need some help over there. Absolutely. Now you got this assignment. It's a temporary assignment for 3 months. Just an example. But okay, cool. Now we're going to go there. Exuberant energy, wonderful attitude towards learning, not getting impatient with ourselves for not learning fast enough. But we're going to get there and we're going to learn. And we're going to apply ourselves. We're going to ask questions, but we're going to do our research. And this little 3-month assignment, while you're still looking for a job, this full-time unicorn job with this high salary that the school promised you, you're still looking for a job out there. Well, guess what? Now what's going on that you're in this temp job? You are making connections. You are applying your skill, unlike the person who doesn't listen to me and says that they're going to apply for a patient access position. Why would you do that? It doesn't even use your skill. Well, Blue, I just want to get into the hospital. If they like you in patient access, you're not moving. Oh, yes, I got to move, Blue. That was where, okay, there's always got to be somebody. There's always got to be that one person, right? But again, I want y'all to be able to find your first job that's going to use your skill. Because if you don't use it, you'll lose it. And a lot of you don't study after you get done, pass your certification. You think that that's it. You know, you don't need to study no more. You do. Well, how do I study, Blue? How do I get practice in? You have your workbook still, don't you? No, I gave those away and I don't have any money. Okay, there's the public library. You know, your tax dollars, your tax dollars are at work at the public library. It's not like 5 years ago, right? During the pandemic when everything was shut down and oh yeah, okay. Now, like if you live in a major city and you go to the public library and you explore what they got there, and you may be able to find a medical coding workbook in there. It may be a couple of years old. It may be a few years old. But if it's giving you scenarios and it's got the answers in it and you still have your coding manuals, maybe you have the 24 editions or the 23 editions, that's okay. You still are practicing looking up codes. You're still making sure that you're learning. The guidelines are on the internet for free. You can actually Google the ICD-10-CM official coding guidelines. The first thing that pops up in Google is the CMS link, the PDF. Now it's 120 something pages, but that's just the type. The type. That's all it is. So don't get overwhelmed, but read it or listen to it. Okay, I posted the instructions on my Patreon. It's on my Patreon page. I have it on here. I've told people, I've explained it several times. I'm not going to explain it no more because again, people were ungrateful. But I mean, if you want to look back to my videos, that's great because I've explained it again and again. So like I said, listen to the guidelines, read the coding guidelines. That way, even though it doesn't make sense to you right now, you're still getting that practice in. When you get out into the real world, you would be surprised how easily things will flow and be like, oh, okay, that's going to make sense because you understand the guidelines. Sometimes, like even I don't think about how much I go through the guidelines. I go through the guidelines quite frequently because of my Patreons because I do tutoring, because I do coaching. So I'm going through these guidelines almost every day. You know what I mean? Like I'm pulling up something, I'm seeing something, I'm referencing something. So I'm talking about this. And sometimes when I don't have anything else going on or I'm at work and somebody asks me a question, it'll be right there, right in my head. And even I get shocked about, how quickly I can recall it. But again, I'm with it every day. So it's not surprising, but it still surprises me. And taking the time to actually work with books as opposed to constantly being online, that's going to help you. What was it? There's a part of the brain that is the hippocampus, right? That expands when you're learning things. So as opposed to dulling your brain with a constant internet. That's why you don't see me on TikTok, because I am not with those 1-second videos, okay? I don't have an account with TikTok for that purpose, because to me it's contributing to the shortened attention span of human beings. And you have to protect your attention span, because the shorter your attention span is, the more likely you are to accept whatever's told to you without using critical thinking. I'm just saying. All right, so how do you deal with denials for office visits with injections, or say 99214 with the modifier 25 appended to it? I typed a template letter and adjusted it as necessary, but they never end. Okay, so Alexandria, I guess you don't know that you can't bill an E&M visit when you have a minor procedure, right? Anything from 0 to 10-day global period. You can't bill an E&M because there's already a component of evaluation and management built into that procedure, unless you are the provider seeing that patient for a separate condition, and in which case it should be documented appropriately in the note, and it should be very clear, right? And it should be okay, like if you're having to link the procedure code and you're having to link the E&M code, you need to link that diagnosis if that's what y'all do. Because for us, when we're working in the encoder and we have a minor procedure done in the same day as an evaluation and management, but these are two different conditions that are being treated, that modifier 25 goes on that E&M, and then I'm linking the diagnosis to that particular E&M code, and then I'm linking the diagnosis that's for the procedure with that code. Now, some insurances are going to require you to have separate diagnoses, and some of them they just don't care. You can have one diagnosis and it's still going to be like evaluation and management and E&M, because these are two separate areas, right? But it really all depends on what's happening. But yeah, you can't get that for that. What are you saying here? Yeah, I feel like my doctors justify it when I bill a 99214 with a 25, but some of these payers always deny. Okay, well, sometimes they deny because either they're just doing it on automatic or it's just not clear. I don't know. It's really kind of hard to tell, but there's some insurances that are very notorious for doing those kind of crooked things. But all you can do is just show, the proof. Show that this 99214 with a 25 modifier was for this particular condition, and this minor procedure was performed on this body part for this condition, which is separate from the other thing. Without looking at it, that's the best I can give you. You know what I'm saying? So hopefully that help. Are remote billing, or remote medical billing still in? There's remote medical billers all the time, but if you don't have experience, it's not going to be an easy thing for you to get. Alexandria says credentials don't equal knowledge and know-how. There you go. Hi, Nadia. Hi, Shanda. Nina says, "Hi Blue, I watched your 2024 CCS exam prep video. Is it still okay to get the 2022 ICD-10-CM and PCS handbook with the answers?" Yes, I'm planning on taking the CCS exam this year. Yes, it's fine. It's fine. It has the same questions in it. Sweet Face says, "I start a 5-month course in July, planning on studying anatomy and physiology and medical terminology, so I'm ahead of the game before then. Using your suggestion in your videos, anything else you think I should?" Well, you've been watching my videos, you know. You know I don't like 5-month programs, but study. You're doing right by making sure that you're going through the medical terminology, anatomy, and physio first. But 5 months, that's really short. But make sure you get with those workbooks, ma'am. I'm just saying. Alexandra says, "It seems automatic for a lot of these payers, and we're always having to explain ourselves. I just thought maybe you have experienced this." I have experienced a denied claim, and I was correct, but it's the billers that handle that. So I don't handle it. They deal with it, not me. But I give them my reference and things like that, and why it's appropriate and things. So yeah, that's the only thing I can think of. The other thing I can think of is whoever's doing the contract. Let me say this kind of slowly because even I get kind of confused. Okay, so whoever is doing the contract for the insurance company, right? And they can always stipulate how much they want to charge for certain procedures, and they get how much they get. And then some procedures they're going to take money that's a little bit lower than others, just so they can get the business. But you can always write into your contract, into that billing contract, that there will be procedures that are performed, minor procedures that are performed in the same visit as an E&M office visit. And so long as it's showing as separate, then you expect to be paid, as long as it's obviously applicable, but you would expect to be paid. I would put that in the contract so that they know not to mess with you. Because if you have that, and then you say, "Look, it's right here," then yes, you absolutely can do it. I'm just saying. Thank you, Blue. I thought about the contracts being an issue. I work as a coder, but I also do some appeals. That would be what I would do. That would absolutely be what I would do. Absolutely. I would look at those contracts, or I would talk to the person who handles the contracts. It's either going to be like the whoever's running the billing side, or like the office manager. They're going to be the ones that are running the billing side. Let's see. What does it say? Romy? Hi, Blue. I just started inpatient coding, and it's very different than outpatient. Yes. Knowing those guidelines and referencing those coding clinics is really important. Yes, it is. It absolutely is. And so, like I say, when I'm telling you guys to prepare yourselves, that's what I mean. I hate to see people not prepared. And then I hate to see people not prepared because they say, "Well, Blue, this program was really cheap. That's why I got it." Yes, a cheap program can be like, it's attractive because it's cheap, but independent study is, the syllabus is free and the books are like a quarter of the cost. Use that to supplement your studies. Use that to supplement your studies. I don't know how else I can say it, or even if when I'm saying things, are people understanding? Like, I don't get it. Like when I say things, I say the Nelly book, and I say, for example, I say Nelly book, and I say it's the Nelly book. It's the ICD-10-CM and ICD-10-PCS coding handbook with the answers. Okay, Nelly Leon Chizen wrote this book, so everybody calls it the Nelly book. I call it the Nelly book. It's the Nelly book, ICD-10-CM and ICD-10-PCS coding handbook with the answers, and I still get, "What is the Nelly book? Why do y'all do this to me?" It is the Nelly book. It is by Nelly Leon Chizen. And if you look at my what is it? My description boxes, you'll see I have it out there. Nelly Leon Chizen. The best book to learn ICD-10-CM from, and or ICD-10-PCS. Perfect. Let's see. Kathy, what's it? Where am I at? Okay, so Kathy says, I'm learning about coding and I'm looking into some programs. What do you think is a good length of course to take? I just heard you say 5 months is too short, so you must really be new to my channel. 9 months, 12 months, or 18 months is an ideal length for a medical billing and coding program. Anything less than that is too short. Okay, it doesn't matter if you have a background of medical terminology and anatomy already, or maybe you're coming over from the nursing side. You still need time to learn. This is not something that you can learn fast. And I don't tell you this so that I'm insulting you. Certainly not. You know, I'm telling you so that you know. 9 months, 12 months, or 18 months is a good length of time. Now, if you're taking the AAPC online course, they say if you add in like the medical terminology course, the anatomy course, and then the coding course, it comes out to 8 months. So you're like 1 month shy. It's fine. I would rather 8 months than these piddly little 5 month courses, 6 month courses, or 4 months, or heaven forbid, the 2 month courses. That's what I would prefer. Because again, it's so much time, and so quickly that they want you to do all these things. And I mean, if you're going to do something that short, it's like you're going to be in it all day long. And that's not conducive for any adult. Okay, it's not. When you are studying, you need to pick a program that's 9 months, 12 months, or 18 months. This is going to give you plenty of time to be able to study. I need a job right now. I get it. You could actually, before you even start the program, you can get into a medical billing position. Why? Because medical billing only requires you to have a high school diploma or a GED. You do not need to have a certification. And oftentimes, you don't have to have experience. And if they do ask for experience, you can still apply anyway. Why? Because they're looking for people who have basic math skills. Now, I don't know if this guy, he had to have been trolling me, because he kept asking the same question. He said, I want to get into medical billing. Is it advanced math that I need to know, like trigonometry and geometry? Why would you need to know geometry for medical billing? Why would you need to know trigonometry for medical billing? Now, percentages, multiplication, division, addition, subtraction, that's basic math, right? That's basic math. This can all be done on a calculator. Why would you need to know geometry and trigonometry, sir? And I told him, I said, no, you just need basic math. Oh, well, do you have to have a high school diploma? Yeah, you got to have a high school diploma or a GED. Oh, well, but is it advanced math? No, you're trolling me now. You're just trolling me. You're trying to get me to say something to you, and I'm not going to do it because I don't have time. I don't have time. And if that's your way to try to get my attention, come on, man. There's better ways. I'm just saying. Kelly says, oh, is it Kelly? And I called you Kathy. I'm so sorry. I'm new. Thank you. Okay. Yes. Sorry. It's light. I can hardly see it. Sweet Face says, course I'm taking is the AAPC curriculum. Okay, good. Juno says, my program was 15 months. Then I took an additional 6 months of independent study with ICD-10-CM and ICD-10-PCS handbook with the answers. Oh, yes, that took 6 months. You have to know your books. Okay. Thanks, Kelly. Dominique, hey, Blue, I'm doing the self-study and wanting to join a HEMA, but their membership for students has certain requirements. Should I just wait until I get my credentials or see if they will accept me now? So in order to get the student rate with a HEMA, you have to be going through an HEMA approved program. Okay, they have a list of approved programs that they have, I guess. But you have to go through a specific program in order to get that rate. So not everybody can get it. And that is like a fraction of the cost, you know. Regular membership is $149. The benefit of having that as a student is that you get access to like the job board. Okay, even as a student you get access to the job board. Now there are some CEUs that you can get with it. Those do not apply to you when you don't have your certification, and you can't start earning your CEUs that's included with your membership until after you get your certification. So if you wanted to wait to closer to time when you have your credential to get the membership, then that's better. Like right before you take your test, like before you schedule your test, so that way you can get the discounted rate, because it's like $100 more than you get the test, you know? So that's what I say. I would just go ahead and wait till you're about ready to take the test, and then get the membership, you know? But if you have an extra $149 that you just, you know, want to go ahead and spend and try to get some connections with the industry, that's totally okay too. I mean, it's up to you. So, but that would be my recommendation on that. But yes, credentials do not equal experience, guys. Just stick with one. Make it easy for yourself. You know, don't feel pressured by the schools. Don't feel pressured by people who don't know. Don't feel pressured by your peers. Don't try to do this keeping up with the Joneses. And that's the other thing too, is that people start to want to compete with each other. Well, such and such has this credential, or I don't know how such and such passed this test. Some people are better at taking tests than others. Okay, sometimes it's just a natural thing for them. But like I say, don't worry about other people. You need to focus on your own lane. I learned, as a coder, that when you focus on yourself and you focus on you let all of the external crap go, as far as like the coworkers that say horrible things about you, or the coworkers that think they know you and they don't, and or just the drama. When you ignore all of that and you start focusing on what really matters, your providers, your own knowledge base, no one can take the genuineness of your relationships away from you with your providers. Nobody can do that. And you become you become known for that. That becomes a part of your skill set, is being able to talk to providers, and you're getting better at communication. You have to be really good at communication when you're talking with providers. But if you have that and then you start concentrating on your own knowledge, again, no one can touch you. When you are knowledgeable about your work, and then it starts to expand because you're so busy focused on your work, you're not concentrated on these other people, and other people trying to compete with you. Doesn't matter. Why? Because you're focused on what you have in front of you. That's when you start to become more successful. That's when you can start to really enjoy what you're doing. And that's what a lot of people are searching for, right? Is to be able to enjoy what they're doing when they're working, because no one wants to be miserable at work forever. And it's not necessary. Some people think it actually is necessary part of work, that they don't enjoy it, and then they just want to go home every day. Me, there's some days I can't wait. I cannot wait to get to work, and it still happens today that I can't wait to get to work, because there's something I get to teach, or there's something I get to do a presentation that day, or I know that I'm going to have a good day with like the encounters that I'm getting, because certain days they have a lot of like either they'll have a lot of challenging ones, or sometimes they'll have like an injection clinic day where they do a lot of injections, which is great because I can knock out a bulk of my productivity for the day, and then I can really concentrate and focus on some of my more challenging encounters. And so that I like, because I like to have time to kind of like look and focus. And sometimes it's because I know I'm getting a new provider, and I'm like, yes, I get to work with them. I get to mold them. I like when I get a brand new resident right out of residency, a brand new doctor right out of residency. That is the best, because I am their first exposure to coders. And they learn. And I tell them, the way that I am with you, you need to expect that when you leave. Because they all leave. This is just a temporary stop for them, right? But when they go, and they either go to another private practice, or they make their own practice, or they go to a part of a group, I said, you need to make sure that everything that I'm doing for you, your coder is doing for you at your new place. you need to demand it. Because you know what it is to talk with a coder and to be connected with a coder. Because otherwise, providers won't. And that's why I tell them, they're like, well, our coder, we never saw our coder at the last place that I was at. Okay, well, that's not the case here. And that's not the case ever even when you're out in the real world. You shouldn't be like, I don't know who my coder is. When I first got here to my forever home, my first supervisor was a lady named Laura, and she used to be a drill sergeant, so she's really, really tough. We were having a meeting one day, and she said, some of y'all are talking to your providers, but they can't pick you out of a lineup because all you do is email them. You all better be going. She was like that. She's like, you all better be going to those clinics and talking to those providers. And so that's what we did, and so that's how they get to know you. And she goes, if so help me, if any of you, the doctor is saying, I don't know who my coder is, we're going to have a problem. I said, okay, no problem. So, it becomes easier, when you think of it like that, when it's like, okay, this is what we have to do. This is what we're going to do. And if you give yourself no choice, right? You give yourself no choice to be afraid. And this is part of your duties. This is part of the things that you can enjoy because it's fun. It's fun talking to some of these doctors. Now, some of them are more challenging than others. And some of them will give you a run for your money. They will make you work. They will make you sweat too. I had a podiatrist who did this to me. So I got him. I finally had him, right? And I didn't have him for many years. And, for many years, he was just somebody else's provider. But he was finally mine. And his documentation was very simple. When I looked at it, I was like, And so I had to query him because there was some stuff that was missing, right? And I said, so here's a query. And he comes back, he goes, I'm not doing it. What do you mean? What do you mean you're not doing it? He's like, I'd never gotten queried before. And I was like, I don't know what to tell you. All I know is that I can't code this without this information. Well, I'm not going to do it. I said, well, then you're not going to get credit. Well, how come? And I said, because I don't have the documentation I need in order to code appropriately. I cannot pick up unspecified codes. I cannot pick up a procedure if I don't know what happened in this procedure. What did you do? How many of this procedure did you do, right? Because podiatry has quantity sensitive procedures where you need to know how much they did in order to pick the code because there's more than one code to pick from. And so I tried to explain that to him. This is stupid. And I was like, yes, it may seem stupid to you, but this is what your fellow brethren says is the case. I didn't make this up. Another doctor made this up. Another group of doctors made this up. You need to look to the AMA, sir. He goes, I'll get to it when I get to it. I said, that's fine. Another month goes by. Nothing. He is just refusing. He will not budge. So I try to sweeten the deal. Okay. So I said, okay. So I brought over the book and I was like, okay, let me show you that this is not just Bleu making this up. This is not Bleu doing this just to make her job easier. I said, And so he goes, it's still stupid. And I said, yes, I know it's still stupid, but this is the AMA. This is the CPT book, And he's like, I don't like it. He said, that's not what they do at this other facility. I said, what they do at the other facility is of no concern to me. I am concerned about you, and I'm concerned about my ability to be able to code your stuff efficiently. So I said, but if you don't want to do it, you know what? I give up. I give up. I said, I can't. There's nothing I can do for you other than I'm going to do my job, send the query, and then if it's not responded to, I'm going to send it through with no credit. That's the only thing I can do. And so all the work that you're doing will be for nothing. I said, but you know what? It's fine. You win. I told him, you win. He said, what do you mean? I said, well, you win. I can't tell you anything. I can't show you. I tried to be nice and show you. I've tried to spend time with you and explain. You don't want it. You don't want it. I can't do anything. I said, so you're right. And I'm going to leave you alone. I can't help you if you won't let me. So then the next day, He comes knocking on my door. And he's standing there. He looks very proud of himself. And I said, good morning. And he goes, did you see? Did I see what? Did you see what I did in my notes? No. What did you do in your notes? I said, something worse. He goes, just look at the notes. I pull up the notes and I'm like, I said, he goes, he's just smiling. And I said, well, and he goes, I couldn't just do it the first time you told me. I said, are you serious? He goes, well, I just didn't know that I was supposed to be doing it that way. I said, again, I can't account for somebody else's knowledge. The only thing I can do is bring you my knowledge. Literally, hands down, one of the best providers I have ever worked with after this. And he even selected his own codes, which was really impressive to me, because sometimes when the providers select their own codes, it's the electronic health record that's helping them out. So sometimes those codes are not exactly the most specific. Sometimes they'll be like unspecified. It'll be a fracture code, it'll be unspecified. And I have to go in and update the code to reflect the laterality. Okay, cool. But it's like, I said, we went through all of that. He goes, yeah, that was fun. I just looked at him and I just shook my head. He goes, well, but I'm glad you're really looking into this. And I said, like I said, a lot of your stuff is like right on the money, but then there's just these certain ones that have like, these are like quantity sensitive that I need to know. And he's like, well, I didn't know that. I was like, well, that's why I'm here, but he's retired now. So, and I miss him. I miss him because like I said, like he's one of my best providers, best documenters, and I could get through stuff really quickly. Sometimes when I'm looking at his stuff, I was able to select other codes because he didn't see it and I saw it. And it was absolutely documented like it was supposed to be. I was like, this is awesome, But that's what you learn, and that's what you do when you enjoy your job. When you step out on that limb and you say, okay, I'm going to communicate with my providers. I'm going to take that extra step and learn more so that I can be more competent. Because you have to be very competent when you're going up against these providers. You have to know that, And for those of you who will get scared and write me later and tell me, oh no, Blue, I didn't know it was going to be that much communication with providers. What do you think this is? You're reading their documentation. They're not meant to be coders. They're meant to be providers. Our job is to make sure that their documentation is clearly reflective of what is happening in that encounter, right? And sometimes places have CDI folks that will help them, and other times they don't. Other times it's just you. Coders wear a lot of hats. A lot of people don't understand this. Coders wear a lot of hats. Me, I wear a lot of hats. I do CDI, form of it anyway, I am the provider educator. I am the coder. I am the one who's chasing them down, trying to help them when they're coming to me and they are just all over the place because they've never had a coder before. I'm the one who does it. Do I have to talk to them sometimes? Yes, absolutely. And does it get frustrating? Absolutely. Especially when they say, well, no one's ever said this before. This is what's out there. This is what's out there. People that just want a check and to be able to go home. But at the same time, they don't understand that when we're looking at documentation, that patient that's in that record, that's in that encounter, that's their permanent record, right? So wherever they go, somebody else is going to be looking at the documentation. Can you imagine if you have a provider who thinks that they're doing it correctly and it turns out they're not? And then that poor patient's out there with this documentation that's not reliable. I saw this thing the other morning on LinkedIn. It was from a doctor that said that she had to go over the patient problem list with the patient, because we can't code from the problem list. We all know this as coders. But she had to go over it herself because it said central sleep apnea. And then it said... it was messing up the words, but it was saying that the patient had COPD, and then that they had something else, pulmonary fibrosis as well. And so it just didn't make sense to her. So she started asking the patient, what do you mean this says that you have COPD and pulmonary fibrosis. And she goes, oh, well, the questionnaire asked me if I had it. And since I thought I had it, I've never been diagnosed with it, but I thought I had it. So I went ahead and checked it off in the affirmative. And can you imagine if the doctor hadn't cared enough to check and double check to make sure? Can you imagine? Like, what if the lady needed surgery? I don't know if it was a lady or a man, but I'm just saying, what if the patient needed a surgery and they see all of these complications on there, these respiratory complications, that could be really bad really fast, Again, coders are on the front lines of this because we're the ones that see this. When I see a note that's all jacked up because they're using like the dictation thing, and I'm like, what is this? They go, oh wow, that's really they go, let me check my notes. And so then they have to amend the note. I'll say, okay, well, that makes a lot more sense because some of that stuff I'm like, what the heck is this? But if you let it go and you don't say anything, again, there goes that patient with that unreliable record, Juno says, now that I have my CCS and my student membership has to be renewed, which membership do you prefer? So there's the membership for $149, and then there's the membership for $209. So the $149 membership gets you, I think, eight CEUs total in the 2 years, because it's like 4, or maybe it's 5. I don't know. I have to look. But one has the $149 one has less CEUs that come with the membership, but still good enough amount of CEUs. I think it comes with 8. And I think the Premier comes with 10. I don't know. Again, I don't know. Yes, I don't know. But anyway, the Premier has more CEUs in it. However, if this is your first credential and this is your first time in, I recommend the $149 membership, because the $209 membership is really good if you have like additional credentials, like you have your degree, or if you have like the CDIP or something else. That would make sense because there's more CEUs that are included with the membership. But right now you just have the one CEU, one credential. I would get the $149 membership. And that's just me being conservative, right? Because you're still getting the membership. You're still getting access to the job boards. You're still getting the discount. It's a little bit more of a discount when you get the $209 membership. If you go to conference, they give you like a little gift bag for attending conference. So there's always that, that's the reason why you would get the $209 membership. You get access to a special lounge, even though I've had the Premier membership and I still have yet to go to the member lounge, the Premier member lounge when it's conference, but I don't know. But yeah, either one of those it's good. There's just more benefits to the $209 one, but it may not even be necessary when you're so new like that, This is my advice anyway. You're welcome, Dominique. Hello, I'm hoping to take the CCA this year. Your channel has been very helpful and informing. Thank you. Oh, my pleasure. Sweet Face says, just curious, you work from home or in the office? In the office. I have my own office embedded in the clinic. We do, some of our coders, a lot of our coders, I think I am the only one who works at the facility full-time, other than the supervisors. They all work at the facility full-time. I may be the only coder that's there full-time. I prefer to be in the clinic. I have my own office that has a door that I can close. I can crank up the radio. There's nobody around me, right? I'm on a hallway where like people can pass by, and I have my own space. It's great. When it was a pandemic and everybody had to be home, I was at home for 5 miserable months. You know what happens when I'm not there? So when the pandemic kicked off and all these things was happening, right? I started getting emails about 2 weeks in. Blue, when are you coming back to the facility? We're not allowed to come back to the facility right now. No, you can come back. And I said, well, my supervisor says I can't come back. And I can't go. And they were like, well, we need you here. And I'm like, but I can't go, because like we don't know what's gonna happen, and so they didn't want any non-essential personnel in the hospital at all, and so I'm just like, oh my gosh. 5 months in, I was like, oh no, 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 no. I was suffering at 1 month in because it's so different. I was so used to the noise and the traffic, of people walking in the hallway. I was used to that. I could not function well at home working remotely for the hospital. I couldn't do it. Like I've worked remotely before and I didn't have that reaction. And I don't know if it was just because it was a pandemic, but when I was working at home for where I work now, and I'm like, oh no, 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 no. And then my providers think that it's okay not to respond to me when I send a query. Oh, so you don't want to respond. You want to ignore my emails because I'm not there to go chase you down. Okay, I see how this is going to go then. So, and I wear heels and they can hear me walking in the hallway in heels. And so whenever they hear me, right, because I'm right there embedded in the clinic, then they know. And especially if they know they've gotten an email, they better hurry up and go look at that email before I come to their door. But yeah, I prefer to be in the hospital. That is where I will stay, of course, as long as they let me, but I do not want to work at home like everybody else, They want to do it, that's fine. But I will be right there because to me, face-to-face communication with my providers is very important to me. Everybody has their reasons for wanting to work at home. But for me, I like the social interaction. I am an introverted person, which is odd because you would think no social interaction. But when it comes to coding, I get extrovert. Like that's what I like to do. And so it becomes a lot easier to communicate and speak and be social, and that's what I do. But if it's the choice between being at home and being at work, I will be at work because my home is my home. My home is my home. I don't like commingling the two. Like I said before, when I did work remotely, I had like a whole social network all set up. I was very active with the church, and I was doing all of those things, so I had a social network already in place. And so working remotely was no big deal. The pandemic, it was like everything was shut down. No, I don't like that. And like I said, I still insist on working in the office. So, thank you, Letty. Sweet Face says, I actually look forward to working in the office for at least 2 years before trying to work from home. You see? And that's the thing, I don't know why people are so hung up on working at home like it's the greatest thing on earth. You miss out on so much when you're working at home and you're away from your providers. And even like for people who have worked remotely and they're like, this is their first time in coding, and they say, well, Blue, I queried the provider and they got mad at me and they had a nasty message for me because I sent them a query. They don't see you, bro. They don't see you. That's why they get upset. Because first of all, who are you to tell them that they're doing something wrong? You've never introduced yourself. You've never gone and seen them face to face. Of course they're going to get upset if they get an email that you need to fix something. First of all, who are you? I would be like that too if I was in their shoes. I would be like, who are you? No, you come meet me first. You let me lay eyes on you, shake your hand, and then we'll talk. And not this little silly dead fish handshake talk. I can't stand that. Shake hands, normal, shake hands, just practice. Anywhere you go, you can practice shaking hands, but it's this little soft thing. People think that's so sweet and so demure. No, it makes you look like you're weak and people can just run right over you. No, I don't think so. I don't think so. And maybe it's my height because I'm 4'11", so maybe it's the height, that makes me extra feisty. But I'm just saying, it's good business to have a good firm handshake that you can look the person in the eye, and you may be very nervous, but it's not a reason to be scared off, And yes, some of these providers are very intimidating because they're so smart. I like talking with really smart people because to me, there's just nothing better than that. You get to pick their brain, but That's what you have to do. You have to spend the time to learn. And then the more that you're not only are you exposed to those providers, but you're exposed to other coders, hopefully, right? And if you're exposed to other coders, then you get to pick their brain too, because everybody has a different level of knowledge coming in. You know, even brand new coders can be stellar coders because they get it. And some people get it quicker than others. And sometimes you may think that you have it and you don't. So, I mean, you don't know until you expose your brain, your mind, your whole thing to the world of health information, of coding, of providers, of being there with them. And you will learn different things from different providers. I have learned from providers who were very direct. I've learned from providers who were very sweet and nice. And I have learned from other providers who are just like, I don't care. I'm gonna make you care. You will care when I'm done, you know? And it turned out, yeah, they do care. You know, and sometimes they like to talk a big talk, like talk a big game. Not here, sir. Not here. We are teammates, and I'm going to help you. So, you know, at least um, that's my thing anyway. Let's see. Valerie says, "Hi, Blue. Will you be speaking at conferences here?" I don't know. I don't know yet. I don't know yet, but I will. I will definitely let everybody know. Candace says, "Hi, Blue. I hope this finds you well. I don't really know how to ask. Is this a career space that allows you autonomy?" I would say I have lots of autonomy. But if I was to say this at work, I'd be like, no, I do everything by the book, you know? When I say autonomy, right? Taking the initiative to work on things on my own, right? And if I'm seeing that there's a problem, my first thing is not to be like, run to my supervisor and say, what do I do? No. My first thought is, if there's a problem, okay, how can I address this? Okay, I need to speak with somebody about, my glasses will not stay up tonight. I need to speak to somebody about setting up a class. So without getting permission, I ask whoever does the scheduling for the educations, right? Can I get on the calendar? I need 1 hour. I used to be able to get 1 hour. Now it's a lot shorter now. It's like 30 minutes. And I feel like I'm going so fast. I hate doing 30 minutes, but I'll take what I can get. Okay. I can take what I can get. And so what I do then I put together the presentation. The presentation is right to the point. Okay. 3 points, 3 things I'm talking about. Doesn't matter if there's a lot of issues. I focus on 3 things. And so I do this all without like having to sit here and go through channels, because somebody doing that would say, oh no, don't do this, don't do that. No. I'm their coder. I'm responsible. And at the end of the day, if somebody else gives them education, I don't know what that person knows, because not everybody knows what I know. I know their documentation. I know them. I know this specialty. And a coding educator who does not regularly do like orthopedics and podiatry may not know all the things that I know, right? So because of that, well, then I need to make sure that I'm going to be the one who does it. But if you start to give people too many options of like, oh no, you're going to do this, you're going to do that, no, then that's when things get messed up. Now, not everybody can do that. Some people will get in trouble for doing that. To me, it's important. I'm doing this. There's a reason for it. I'm not fooling around with these people. This is for a purpose. And me having the autonomy to do this without just, oh, you know, like I said, sometimes you have to do things, you know, like take initiative. And as long as it works out, you're still doing your job. You're not letting anything slide. I see nothing wrong with it, but other people would be upset with it. But I say that there's autonomy there. And then sometimes, like depending on where you work, they may not really understand what we do. So then that means you have to be able to take the reins. You're going to be able to chart the course for all of your providers in that clinic. And you're going to be able to do all of these things because somebody else may not have done that before. So yes, there is potential for a lot of autonomy. But with autonomy comes responsibility, which is, like I said, it goes back to, I did this. I stuck my neck out because it's just like, okay, I'm going to do this without asking. but I'm going to set this up. I'm going to make sure that I do all these things. And they were right there. All the providers attended, and they were listening. They were engaged. Their documentation got better. Their documentation got to be used as examples for other facilities. How did that happen? Because I was doing that. Then, okay, I can't always meet with them all the time. So let me do another thing. Let me do coding tip of the week. Coding tip of the week is my thing. So I would send out a little tip every week, right? A little one page, really quick snapshot. Did I include 100,000 people in my chain on it? No, I sent it directly to my providers. And they started to look forward to that every week because it was just a really quick thing, and it put the thought in their mind, okay, A is for initial or active treatment for injuries, D is for subsequent, S is for sequela, and this is how we do sequela. And I broke these things down so that it's manageable. It's not overwhelming. Well, then one of my providers left and was, when they leave, they out process, right? So they have to go around, get signatures, make sure their encounters are closed. They don't have anything left pending open. And one of my providers that left, he went to my supervisor and he goes, I'm really going to miss Miss Bleu. She is a fantastic coder. And she's like, oh yes, my supervisor, yes, sure, she's a great coder. Yeah, she does this thing. It's called Coding Tip of the Week. And, she gives us all this education. I'm really going to miss that. My supervisor was like, oh, she does. What is this coding tip of the week? He's like, oh yeah, it's this really little quick snapshot. And she's been really good with this. And I'm going to miss all that. And she goes, oh, okay. Well, that's really awesome. Did I get a call? Bleu, what is this? And then I said, oh, that, I did that for the providers. And she goes, well, I didn't know you did that. And I go, well, I mean, isn't part of what I'm supposed to do educate? So that's what I'm doing, is educating. And so she goes, well, let me know so that I can see these tips, because he was very impressed with these tips. And I was like, oh. And then she goes, well, good job. And I was like, okay, But again, I worked with some autonomy there. I did it. I didn't ask permission. I just did it. There's an expression that says sometimes it's better to ask for forgiveness than it is for permission. That's one of those instances, But it worked out, right? Because their documentation improved. It's so much so that they're being used as examples. They extract the patient information and all that identifier stuff, and they show it to everybody. This is what good documentation looks like. So I think we're doing something right. But again, a lot of responsibility there. So hopefully that answers your question. Joe says, hi, Bleu. What are your thoughts on paying for educational webinars out of your own pocket? I don't think my team has the same drive I do and want to sponge up as much as you can. Any investment in your education is a good thing. Don't go wild, obviously, but if it's something that you want to know about and you want to pay a couple dollars for, there's nothing wrong with it. That's an investment in your knowledge. I paid for myself to go. When I started going to conference, I paid for myself to go, the whole thing. Because, of course, I wasn't high up enough on the food chain at work for them to pay for me. So I was like, you know what? I'm not going to let that stop me. I paid. So every single time that I've paid for anything in education, and when we were switching over to ICD-10, I went and AHIMA used to do these little get-togethers where they do these workshops, and they did one for ICD-10 when it first came out, and ICD-10 PCS, they did that too, but they did it in Vegas. And so I'm like, heck yes, any reason to go to Vegas. So I went out there, I paid for it, and I met a lot of really awesome people I still keep up with today. So it's always an investment. It's always a good thing. It doesn't matter if it's a webinar, doesn't matter if it's a class, doesn't matter if it's anything. If you're putting out money into this and you're getting something from it, that's always a good thing. Hi, Meds Coder. Juno says, I give you so much credit for coding ortho. It can be extremely specific coding and you have to know anatomy. To me, it is difficult. It is more difficult in school, but so interesting. Yes, you do have to know. buccal fracture and a torus fracture are the same, right? They use the terms synonymously, and it's on pediatric patients. That's who gets them, you know? So it's just like, okay, like if you don't know that, that's a problem, you know? What are your thoughts about EIN job opportunity? What is EIN job opportunity? I don't know. What is EIN? Anybody know what that is? I don't know what it is, or I'm not thinking of it right now off the top of my head. I don't know what it is. But yes, that's my message. That's my message, you know. So like I say, I don't mean to overwhelm people. I just get excited when I talk about coding, but or at least the field. And you know, you can too. You don't have to make it so pressure filled as far as like feeling the pressure to get all these memberships or be dual certified through a HEMA and AAPC. That's just so, that's just such a waste of money in the first year, right? If you're with a HEMA, stay with a HEMA. If you're with APC, stay with APC, you know? But I mean, it's up to you. It's entirely up to you. Sometimes people will say, well, I got certified with a HEMA, but I really like AAPC because they have a lot of like, they have a lot more group meetings and things like that. You can still be a member of a HEMA and still attend AAPC events. I'm just saying, you know. Why do y'all ask these questions? Sweet face. There's 3 ways to learn coding that I've recommended because I don't have relationships with these schools, and I don't want to ever recommend something because my endorsement is not for sale. Okay, I already had a scumbag that tried to get me to sell his program. No, sir. But there's 3 ways to learn. You go directly to AHEMA. They have their online course. They have the 13 course bundle, or you can purchase the courses a la carte, right? One at a time if you want to. But if you purchase all the courses at one time, that's going to be 365 days. You get to complete that program. If you do not complete it in time, there is no extension. Okay. You can go to AAPC and you can take their CPC course, their coding course, you know, get all of the other education you need through there as far as like the medical terminology and the anatomy. You can do that as well. Because though I'm not with AAPC, I've never been through their course. I can say without a doubt, if these come from, if the education comes directly from the associations, that's a good thing. And they're both roughly $5,000, okay, give or take, okay, some it's, you know, give or take around there, because the AHEMA course is $29.99, right, $2,999. But then you have to pay for the book separately. AAPC, I think they include all of that other stuff. So again, it's roughly $5,000 if you go through either association, okay? Or you could go through my independent study, which is available all over all of my videos. I literally list out the syllabus starting from step 1 to step 7, okay? Gather all the books. All the books are there. They're all listed there. This is free. This is a free resource, even though some people still dislike every time I talk about it, which is so stupid, because I'm giving you guys something for free. All you have to do is go buy the books, or you can go to the public library and check out the books, okay? Optum is where you want to get your coding manuals from, because Optum books, except for the AMA, the CPT Professional Edition, everybody's got to have that. But Optum is the one that all of the medical coding, the 4 main medical coding certification exams, the CCS, the CCA, the CCSP, or the CPC, they all accept Optum books, and of course the CPT Professional Edition. So if you want to get your Optum ICD-10 CM expert for physicians, that's good. If you want to get the HCPCS expert, that's also good. If you want to get the ICD-10 PCS book, the spiral bound book from Optum, that's also good. You can use those manuals, and those manuals have extra helps in them that will help you to learn the book. It's much more comprehensive than any other publisher, and so you can go through that. The independent study will take you anywhere between 9 months or 12 months. You can go all the way to 18 months if you want to. Okay, so a HEMA will take you a whole year. AAPC will take you 8 months, but you may still need to be studying, later on. It all depends. I don't have relationships with these schools as far as like this school or that school, this school, or that school. Some schools are more expensive than others. You shouldn't really be paying more than $5,000 for a program. At least that's just my advice anyway. But there's people who have paid like 20 and 30,000. Some of them take loans for a medical coding program, which you shouldn't do, because there's so much free information out there to be able to get so that you can learn. It just takes a little bit of self-discipline. And if you tell me, well, Blue, I don't have self-discipline, I need somebody to be right there holding my hand. Well, you're going to need to learn really quick that you got to be more self-sustaining than that. Two, you could go through independent study and you can hire yourself a tutor to meet with like every other week. If you say, well, Blue, I don't have the money for that. Okay, well then find a mentor. Find a mentor. A mentor will help you for free. Okay. But a tutor can be more surgical, right? As far as like with what your needs are. A tutor is going to help you to isolate what's wrong. Tutor is not meant to sit here and give you a design of a program, and tell you, oh, you're going to work through chapter 1 through 3. You're going to work chapter 5 to 6, on this day and that day. No. The tutor is there to answer your questions. Blue, if you're coming to me and you're saying, Blue, and we're in a tutoring session and we're on Zoom, because that's how I do my sessions, 1 hour minimum, okay? I don't do this 15 minutes, 30 minutes. I don't do that. For my tutoring sessions, it is 1 hour minimum. We meet on Zoom and we're sitting there just like me and you are talking right now. And you come to me, this is my issue. This is my problem. I don't understand injury coding. And I've been, this is a scenario I was going through and I just don't understand, what the problem is. What I will not do in tutoring, though, is some people have said, well, I'm taking a job test. Heck no, I'm not going to help you. That's a job test. It's an assessment of your skills, not assessment of my skills. But we go over what your issues are, and I explain things. And sometimes that's what you need. You need somebody to explain it to you, okay? But, that's just an option. Everybody charges differently, it really all depends on the tutor and what their skill set is. Some people think that it's okay to have a CPCA and call themselves a tutor. That makes me worried, because what do you know? You have a CPCA, you have less than 2 years of experience, and you're calling yourself a tutor. That's worrisome. Now, while I will not dismiss brand new coders as being really smart and, knowledgeable, there's a difference when you're speaking with somebody that has real world experience versus somebody who is just brand new, still with a book. Just saying. All right. So Sweet Face, that's what I can recommend. The independent study, AHIMA or AAPC. Shanice, yes, the CCA is absolutely worth it. I had it for 13 years. No one could ever tell me anything bad about it. And I changed hearts and minds, and I ran circles around people who have degrees and advanced credentials. So yes, it is absolutely worth it. It is the caliber of the coder that makes a difference, not the credential itself. Tora says, I'm a social worker who has capped my hourly pay, and I'm considering switching to medical coding, but I will have to take a significant pay cut. Has one done this? If you're, Tora, if you're really concerned and worried about pay, I would not pursue this, because if you are chasing the money because you're saying, well, I capped out on this, the potential for medical coders, what they make is really high. But you have to earn it. You have to work up to that. It's not going to happen overnight. It's going to take time, and you have to build your knowledge. But if you're just chasing it, or if you want to do it just because you're looking at the money, don't do it. Don't do it. Sweet Face says, I can appreciate that. Simone says, I was laid off and attempting to go through WIOA like you did. Yay! Did the process take long for you to get financing? No. I think it was like a week because they had me there with the check like a week later. So it didn't take long. But I mean, it all depends. So I mean, it depends on your state and it depends on the funding and it depends on what's going on too. Joe says, dang, well, my company just paid for my CPC course and exam. I do have a CCA. I don't think I'll really like outpatient coding, but it was for free, LOL. Planning on taking my CCS shortly after my CPC. Can you please post a link for your training? Again, it's in the description box. Sweet Face says, you're the best, so I appreciate your help. Sorry, so much questions. That's what the show is about, is your questions. Lillian says, I am just starting out on this journey, barely chapter 1. Did you write notes in the training manual? In the training manual, you can write all over your coding workbooks all you want to, but you leave the coding manuals clean. Your ICD-10-CM book, your CPT book, your HCPCS book, your ICD-10-PCS book, you do not write in those books. Don't flag, don't write, don't tab, don't highlight, don't do the stupid circling because it's a waste. Okay? It's a waste. But you can write all you want to in your workbooks. Absolutely. All right. Okay. All right. Well, so I think we've chatted enough tonight because I have a lot of stuff I have to do. And like I said, I will post a video for tomorrow, but I may not be in the chat tomorrow. So keep it clean. And I will get back with y'all. See y'all again on tomorrow night. Y'all see me, but I'll be back in the chat on Monday night, which is the 10th. So I'll be back in the chat Monday night. You're welcome, Lillian. All right. So with that said, I'm going to go ahead and wrap this one up. But yes, if you're out there, study. Take advantage of the public library. Okay? Stop spending money unnecessarily because you think it's going to make you more money to spend money. Okay? No. What's gonna make you more money is having a bigger knowledge base and knowing your anatomy and your medical terminology. That's what's going to help you. Okay? Understanding the coding rules. That's what's going to help you. Practicing with the coding. That's what's going to help you. That's what's going to help you to make more money. Not all these silly credentials. Later on, when you've had experience, then yes, absolutely go for it. After it's been 2 years and you've got experience and you're in the industry, but not a moment sooner. That's just my advice anyway. All right. You're welcome, Joe. All right, guys. I'll see y'all next time. Bye.